asking some couple of questions. Please answer to me.
Yes, sir.
Do you have any problems with your head and face like trauma or any head injury?
No, sir.
Do you have any itchy scalp?
No, sir.
Okay. Do you have any query about the exam?
No, sir.
Okay. Brilliant. Now can I assess your head and face?
Sure.
Okay. Now we are ready to assess the head and face. Before that, wear gloves. First, inspect the head and face. It should be normal in size, shape, symmetry and contour. There should be no any abnormalities like depression or bulging. Inspect the patient's hair and note its distribution, quantity, texture and color of the hair. The hair should not be extremely dry or oily and should not contain scales, nits or dandruff. Palpate the patient's scalp, which should be movable and free of lesions, and we may feel bony prominence in the forehead, at the side of the parietal bones and behind the ears. These are normal. Using the tips of index and middle finger, palpate the temporal arteries. Their pulsation should feel equal. Press thumb under the inner aspect of the orbits to palpate the frontal sinuses and press under the zygomatic bones to palpate the maxillary sinuses. Palpating and percussing the sinuses should not cause pain or tenderness. Next, move your fingers to the patient temporomandibular joint. As you palpate with your middle fingers, instruct the patient to open and close his mouth. The joint should move freely and painlessly. Can you open and close your mouth for me? Or 2 to 3 times slowly?
Yes, sir.
Okay, thank you. This technique assesses the joint mobility and the motor function of the trigeminal nerve. To test the facial muscles and the motor portion of the facial and trigeminal nerve, ask the patient to raise and lower his eyebrows. Can you raise and lower your eyebrows for me? Okay. Can you bare your teeth? Okay. Can you smile broadly? Okay. Can you puff out your cheeks? Okay. Can you close your mouth for me against my resistance? Okay. All of these movements should be symmetrical. Test the sensory portion of the facial nerve by identifying sweet, sour, bitter and salty substances. Can you close your eyes and tell me which taste it is?
Okay, sir.
Open your mouth. Open your eyes. Tell me which taste it is.
It's salt.
Okay. To assist the sensory portion of the trigeminal nerve, test the patient's ability to identify simple touch. Could you please close your eyes and tell me where you feel the sensation?
Yes, sir. Above my right eyebrow. Above my left eyebrow. Right cheek. Left cheek. Chin.
Normally, patient should feel the sensation equally on either side of his face. Mr. Ajay, this completes the head and face examination. You can get relaxed.
Okay, sir.
I performed head and face general physical examination on Mr. Ajay Kumar. His skull and face are symmetrical in size and shape. Hair is black, long, thick, oily and evenly distributed. No any dandruff, scales or nits. Facial symmetry is present. Temporal artery pulsation is normal. Normal jaw movement present. So let us move on to eye examination. Mr. Ajay, now I am going to start assessing your eyes by asking some couple of questions. Is that okay with you?
Yes, sir.
Okay. Do you have any problems with your eyes?
No, sir.
Have you ever had eye surgery or eye injury?
No sir, I don't have any injury.
Do you have any questions about the exam?
No sir.
So Mr. Ajay will now examine your eyes.
Yeah, sure sir.
Now inspect the patient's eyes and external eye structure. The eye should appear symmetrical and the eyebrows should be free of scaling. The upper eyelids should partially cover the iris with eyelashes turned outwards. Now test for the oculometer nerve by asking the patient to close his eyes. The eyelids should move symmetrically without tremors. Please can you close your eyes gently?
Yes sir.
Normally the eye should close symmetrically, but in abnormal condition, tremors will be seen. Mr. Ajay, will you close one eye with this cord and try to read aloud with a Snellen chart from the top?
Yes.
Can you read this line with your left eye?
Yes sir. L D C Z O T E L.
Okay. And please do repeat this for under eye.
L D C Z O T E L.
Can you close your eyes for me?
Sure sir.
Okay. Now gently palpate the eyelids to detect nodules or tenderness. You can open your eyes now. Could you look up? Now we can inspect the lower conjunctiva. Mr. Ajay, can you look down? Now we can inspect the upper conjunctiva and sclera. The conjunctiva should be pink and free of exudate, and the sclera should be white. Now I am going to gently press your corner of the eye. The lacrimal apparatus should not produce exudate or excessive tearing. Now we will check the patient eye muscle function by assessing extraocular muscles and innervation of oculomotor, trochlear and abducens nerve. By placing the finger 12 inches far from the patient eye, instruct the patient to watch finger as it moves. Please do follow the direction of my finger without moving your head.
Okay sir.
Upper right, far right, lower right, lower left, far left, upper left. The eye should move together equally, smoothly through these 6 cardinal positions. 1 or 2 beats of nystagmus in lateral position of the gaze is normal, but in other position it becomes abnormal. To test the accommodation, keep your finger 4 inches from the patient nose. Mr. Ajay, please do follow my commands. Look at the tip of my finger. Now see the wall behind me. Here we look for his pupils. They should constrict when he focuses on my finger. Next, inspect for the pupils. Normally the pupils are 3 to 4 millimeters wide and equally round. Check the patient pupillary light reflex to assist the optic and oculomotor nerves. Shine the light on one pupil from the side by maintaining 12 inches from the patient eye. Same on the other pupil. When the light shines on the right pupil, pupil should constrict directly, and also left pupil should constrict simultaneously. Document this finding as Parla. Pupils equal, round, reactive to light and accommodation. Mr. Ajay, this completes your eye examination. Thank you so much for your cooperation and you can get relaxed now. Mr. Ajay has normal symmetry of the eye, no redness and discharge noted, conjunctiva and sclera appears moist and smooth, nasolacrimal duct appears to be normal with no drainage when palpated. Iris are round and pupils are equal in size and reactive to light symmetrically. He also has normal visual acuity of 20 by 20. So let us move on to ear examination. Mr. Ajay, can you move to ear examination now?
Yeah, sure, sir.
Okay. Before examining you, I would like to ask you some of the questions. Is that okay with you?
Okay, sir.
Do you have ear pain?
No, sir.
Do you have any dryness from one or both ears?
No, sir.
Have you ever had any ear surgery before?
Yeah, it's not, sir.
No. Do you have any questions about the exam?
No, sir.
No. Now let's begin with the ear examination. Ear examination starts with the inspection. Inspect for the placement of ear and looking at the external canal for any discharge, drainage, scar, lesions, signs of infection or inflammation, or any deformity. Next, now I am going to do tug test, where I take the pinna with my hand and just lightly tug back, up and down on the auricle. If the pinna shows pain, that can indicate some inflammation and possible infection in the internal canal. So always do the tug test before you go ahead and put the otoscope into the ear canal. To inspect the inner ear, I will use otoscope. Make sure that the tip of the otoscope should be sterile. Before inserting the otoscope, make sure to strain out the ear canal by gently pulling the patient's ear upwards, backwards and away from the ear. I will gently place otoscope inside the ear canal, stabilizing my patient. Now I am inspecting the ear canal, looking for any abnormalities like discharge, any lesions or scar, and also check tympanic membrane for shape, structure and bony prominence. And I will do the same for the other ear by following same steps. Now I am going to perform the whisper voice test. In this test, I am going to whisper like puzzle or ripple in each ear. Before that, I ask the patient to close one ear for me so that I can check other ear auditory activity. Mr. Ajay, can you close left ear for me? Please repeat after me.
Okay, sir.
Puzzle.
Puzzle.
So same thing you repeat in the other ear. Auditory functions can be examined through these tests too: finger friction test, watch test, speech test. Next, Weber and Rennie test. Weber test. For the Weber test, use the 512 Hz tuning fork and strike on the hardest part of the palm. Or you can pinch the top of the tuning fork to make the sound. Apply it on the top of the patient head and ask the patient if he can hear it equally on both sides. Mr. Ajay, can you hear it equally in the both of ears?
Yes, sir.
Okay. So normal results would be that sound is heard equal in both ears. If the sound is heard only in the one ear, let's say to the right ear, is an indicative of conductive hearing loss on right ear and sensory neural loss on the other ear. If you do find an abnormal results like that, you can perform a Rennie test. Rennie test, we use the same tuning fork by pinching the tips again, then place it on mustard process of the patient. Then near to the external auditory canal. Can you hear this sound?
Yes, sir.
It indicates normal results because air conduction should be always greater than bone conduction. Repeat it on the other ear. This completes your ear examination. Thank you so much for your cooperation, Mr. Ajay. I performed ear examination of Mr. Ajay Kumar. Ears are equal in size and shape bilaterally. Auricles are aligned with a corner on each eye, and color is same as the facial skin. No discharge and pre-op lesions on assessment noted. There is no any abnormalities in hearing of both ears. When assessed with the Weber and Rennie test, the results are normal. There is no any abnormalities in otoscopic examination. So let us move on to nose examination. Before starting the examination, I will ask you some couple of questions. Is that okay with you?
Okay, sir.
Do you have frequent nasal discharge?
No, sir.
Do you have frequent nasal bleeding?
No, sir.
Do you have any queries about the exam?
No, sir.
Okay. Well then, now let's start with the examination.
Sure, sir.
Inspect the nose for any scar, lesions or any deformities. Instruct the patient to tilt his head back and stabilize his forehead. Can you please tilt your head back? Gently place the short white tip speculum into the base of the nostril. If the patient does present with a nasal obstruction, you also want to assess each nostril. Press down one nostril, instruct the patient to take deep breath in and out. Can you take deep breath now? Okay. This is performed only if the patient present with any signs of nasal obstruction. Let's now assess the functioning of olfactory nerve by instructing the patient to close his both eyes and smell ingredient. Can you close your eyes and smell the substance placed in front of you?
Okay, sir.
Tell me which substance it is.
Sir, it's coffee powder.
Yes. Brilliant. Let us now assess the frontal and maxillary sinuses by palpation and percussion. Do you feel any pain over here?
No, sir.
Percussion of the sinus is important as it helps to loosening of any mucus that may be located inside the sinuses. Mr. Ajay, this completes your nose examination. Thank you so much for your cooperation.
That's fine.
Okay. My client Mr. Ajay Kumar doesn't have any history of nasal discharge or nasal bleeding. His nose appears to be normal without any scar, lesions and deformities. He doesn't have any nasal obstruction. Nasal mucosa is moist and nasal septum is intact in nature. Normal functioning of olfactory nerve is evident. On palpation of sinuses, there is no any pain or tenderness present. So let us move on to mouth examination. Do you have any problems during chewing the food?
No, sir.
Okay. Do you have any frequent mouth ulcers?
No, sir. I don't have any mouth ulcers.
Okay. Do you have any queries related to the exam?
No, sir.
So let us move on to the mouth examination. Inspection of the patient lips should be done to detect any lumps, cracks or scales. Also note for symmetrical closure of the lips. Document if any abnormal findings present. Also assess for oral mucosal condition by using tongue depressor and torch. Could you please open your mouth for me? Instruct the patient to bite down and bare his teeth. Can you bite your teeth by opening your mouth? While assessing jaw alignment in the front of the mouth, the upper teeth should override the lower teeth slightly. Assess the patient teeth and gums. Please open your mouth for me. Normally, adults have 32 evenly shaped ivory colored teeth that are firmly embedded in the gums. Now inspect the rest of the oral cavity by using torch and tongue blade. The hard palate should appear bony and whitish. The soft palate should look muscular and pinkish. The uvula should be pink, in midline and pre-op lesions. Instruct the patient to stick out his tongue. It should be in midline and pre-op tremors. Now inspect the tongue. The dorsal surface should be symmetrical, slightly rough with a midline groove and with small fissures. The ventral surface should be smooth and pink with visible veins. Using gauze pad, hold the patient tongue to one side and palpate the floor of the mouth. You should feel no lumps or any abnormalities. Mr. Ajay, would you try to exert pressure against the depressor?
Yes, sir.
This action tests the hypoglossal nerve. To check the glossopharyngeal and vagus nerve functioning, depress the tongue and instruct the patient to say ah. Now I will place a tongue depressor in your mouth. Please do open your mouth and say ah while examination. Now observe for symmetrical rise of soft palate. Uvula should be placed in midline position. And also assess for pharynx and tonsils for smooth and pink color. Grade the size of the tonsil on scale from +1 if the tonsils are visible, +4 if they touch each other. Lightly touch the back of his tongue. With a tongue blade, he should gag. This reflex is known as gag reflex, which assesses the functioning of glossopharyngeal and vagus nerve. Now let us examine the functioning of facial and glossopharyngeal nerve. To identify the sense of taste, instruct the patient to close his eyes and open his mouth to taste some ingredient. Mr. Ajay, can you taste this ingredient by closing your eyes?
Yes, sir.
Open your mouth. Can you tell me which taste it is?
It's sugar.
Yes. Mr. Ajay, this completes your mouth examination. Thank you so much for your cooperation.
That's fine, sir.
Okay. My client Mr. Ajay has normal shape and symmetry of the mouth. Lips are moist and normal in color, without any lumps, cracks or any abnormalities. Mucus appears pink in color. Uvula is pink and it is in midline. Hypoglossal, glossopharyngeal and vagus nerve functions are normal. So let us move on to neck examination. Before heading with the examination, can I ask you some questions?
Yeah, sure, sir.
Do you feel any difficulty in swallowing?
No.
Do you have any difficulty problem with the neck movements?
No, sir.
That's fine. Do you have any questions regarding the examination?
No, sir.
Okay. Then let's start with the neck examination.
Yeah, sure.
Inspect the neck initially and instruct the patient to extend his neck up. Assess for the tracheal positioning in midline. Also look for any lesions or lumps like goiter. And also check for prominence of Adam's apple. We can check position of the trachea by placing ring and index finger over two clavicular head and keep middle finger over tracheal side and find the normal midline tracheal position. Now let us assess accessory nerve. Mr. Ajay, can you move your neck side to side? And up and down? Now to assess the distension of jugular vein, ask the patient to turn his head one side. Could you please turn your head to my side? Now I am going to palpate your neck region. Please do tell me if you feel pain or any tenderness.
Okay, sir.
Palpate the lymph nodes, starting with the preauricular region, that is before the ear. Use your 2 to 3 fingers in a circular manner to assess the lymph nodes. Also, assess for posterior auricular region, that is behind the ear, and further moving down to tonsillar, submandibular and submental region right below his chin. Moving on to lymph nodes. Now I am going to palpate your neck region. Please do tell me if you feel pain or any tenderness. Palpate the lymph nodes starting with the preauricular region, that is before the ear. Use your 2 to 3 fingers in a circular manner to assess the lymph nodes. Also assess for posterior auricular region, that is behind the ear, and further moving down to tonsillar, submandibular and submental region right below his chin. And then assess for anterior and posterior cervical region near to the sternocleidomastoid muscle. For palpation of the thyroid gland, instruct the patient to have a sip of water. This helps to assist movement of the thyroid gland. Mr. Ajay, please have a sip of water.
Okay, sir.
Thank you. This completes your neck examination. Thank you so much for your cooperation.
That's fine, sir.
Mr. Ajay has normal shape and size of the neck. Position of the trachea is in midline and there is no lesions or lumps. Prominence of Adam's apple is noted. The accessory nerve functions is normal. Distension of the jugular vein is absent. There is no any enlargement of thyroid gland. Lymph nodes on palpation appears to be normal. So let us move on to chest examination.